It's time to get your coronavirus and medical questions answered live.
The number to call is 270-9933. Dr. Zorba Paster joins us once again. And let's go to Catherine in Madison. Hi, Catherine. What's your question?
Hi. I'm wondering what your thoughts are about going to the dentist to get your teeth cleaned as long as they're following the safe guidelines.
I think that that is a safe thing to do. Is there a risk? They're really, really good. I just went to my dentist, had my teeth cleaned. I was very happy with what they did. They came out, checked my temperature, asked me a bunch of questions. I went in with a mask. Obviously, I'm going to have my mask off while they're doing my teeth, but they had their masks on the rest of the time. Is there a risk? There's probably a little risk because you're going there, but there's a risk whenever you go out. So to me, the risk is minimal. The risk is greatest going out to a bar in Rock County or Greene County. That's where you're going to get COVID, not at the dentist.
All right, let's go to Kathy in Madison. Hi, Kathy. What's your question?
Hi, everyone. I just have a question and concern. I did test positive for the antibodies for the COVID virus. When the vaccine comes out, will there be any concern with me getting that or any contraindications before I do receive it?
Yeah, most likely not. You know, we give immunizations to people who have influenza all the time. We don't check them for antibodies, and they may have antibodies for the previous immunization. And the coronavirus is most likely close to the immunization that we get for influenza. So I would say no, you could do it. By the way, influenza rates are dropping in the southern hemisphere in Australia and New Zealand. They're the first ones to get influenza. And the reason why they're dropping dramatically is because people are wearing masks when they're sick and they're not commingling. So it's very interesting. If we do that, we also will cut our influenza season really short.
All right.
That's interesting.
Yeah, that is very interesting. Let's go to Steve in Middleton. Hi, Steve. What's your question?
How you doing, Doctor? I am over 70 years old. I wear my mask, do everything I can. What I can't understand is I have a friend who lives up in Richland Center. I said, hey, you know, do you guys wear a mask up there? A few people. It's no big deal, you know. We live up here in the country. We're not even worried about that. You are telling me some useful information. Why aren't other physicians up in the entire area in Wisconsin preaching the same thing? And why can't we? Why do I drive 25 miles away from Madison and I don't have to wear a mask? I don't understand this.
Right. Well, we have to educate people. Ultimately, that's what Dr. Fauci says. The answer is education. The answer is to keep on doing it. Remember, when we told people we wanted no smoking in restaurants and no smoking in bars, it took a while before people actually said we're not going to do it. And it's going to be the same for masks. But masks, we're in the middle of a pandemic, and the answer to your friend who doesn't wear masks is wear a mask. You're keeping me healthy when you wear a mask.
We're one of the few states without a statewide mandate, so...
Right. Well, that's because politics has entered into public health. And public health should simply be run by doctors, by scientists, and not by politicians. I don't know of any politician in the state of Wisconsin who has an MD degree. Why are they interfering with public health? And the answer is, I don't know. You figure it out.
All right. Let's go to Sandra in Sun Prairie. Hi, Sandra. What's your question?
Yes. Does just a blood test determine that you have the coronavirus without doing anything else, just having blood work done?
Well, first of all, we don't really know what it means, and secondarily, there are false positives and false negatives. So you may get a blood test says you don't have it when you do, and your blood test may say you do have it when you don't. So the blood tests are sort of all over their place in terms of their sensitivity and something we call their specificity. The other issue is, even if you have antibodies to coronavirus, we don't know what that means. We don't know if you're actually immune to it. So unless you're actually ill and actually sick, I think the tests are not worth very much. Now, the active test that you do to see whether or not you actively have coronavirus, in other words, where you have a swab in your nose, they're very important because they'll tell you whether or not you have to self-isolate. That test is the one we should keep on doing more and more and more often.
I think that's what she was asking. It's not a blood test. You've got to do the swab for the...
It's not a blood test. It's the nasal... But people do ask for the blood test all the time, and they wonder if they have it, and the answer is that's not the test we want. We want the swab.
Okay, let's try to get Arthur in Madison in here before we go. Hi, Arthur. What's your question?
Hi.
I was wondering if somebody's downwind and you can smell like their suntan lotion or something like that, what if they sneeze and blow it like 12 feet or so away? Can you still get coronavirus?
Well, generally it's 6 feet apart and you're okay. That's generally what the thought is. So 12 feet, you're going to be pretty safe. Is there a risk and they sneeze on you? Maybe a little risk, but generally 6 feet is the answer, and 6 feet works.
And wear a mask.
Wear a mask. That's
Zorba,
right.
thank you. Thank you all for calling in. We're out of time. We'll do this again next week.
Thank you, Zorba. Good to see you.
We'll have a final
My
check
pleasure.
We'll have a final check of your forecast coming up.